Hello, Emma. Can you explain the branching of the airways from the trachea to the alveoli?
Of course. Let's start with the trachea, also known as the windpipe. The trachea is a tube that connects to the larynx and is situated between the C6 and Th4 vertebrae. It attaches to the cricoid cartilage via the cricotracheal ligament.
What is the structure of the trachea like?
The trachea is formed by tracheal cartilages, which are cartilaginous and horseshoe-shaped structures providing a firm and elastic framework. These cartilages are linked by annular ligaments. The back part of the trachea, called the membranous wall, is made of connective tissue, and beneath it lies the trachealis muscle, a smooth muscle that regulates the diameter of the trachea under the influence of the parasympathetic and sympathetic nervous systems. In front of the trachea is the pretracheal fascia, which transitions to form the adventitia, a loosely structured fibrous membrane.
What can you tell me about the inside of the trachea?
Inside the trachea, you'll find vertical folds of mucous membrane called plesiverticals. The walls contain elastic fibers that anchor the mucosa to the cartilage and extend through the muscular layer dorsally. There are also multiple tracheal glands located under the mucosa. The entire respiratory tract is lined with ciliated epithelium, which helps move mucus and trapped particles out of the airways.
What happens after the trachea?
The trachea divides at the level of the Th4 vertebra into the right and left main bronchi, creating a ridge called the carina, which is visible during endoscopy. This branching structure is known as the bronchial tree. The main bronchi, also called bronchi principales, branch at an angle between 70 to 90 degrees.
Is there any difference between the right and left main bronchi?
Yes, there are significant differences. The right main bronchus branches at about 30 degrees from the vertical line of the trachea and is shorter, wider, and more vertical compared to the left bronchus. This is why inhaled foreign objects are more likely to enter the right bronchus. In contrast, the left main bronchus branches at about 60 degrees, making it longer, narrower, and more curved.
What happens after the main bronchi enter the lungs?
Upon entering the lungs at the hilum, the main bronchi divide dichotomously, meaning each bronchus splits into two. This forms the lobar bronchi. The right lung has three lobar bronchi, the superior, middle, and inferior lobar bronchi. The middle and inferior lobes are served by the intermediate bronchus. The left lung has two lobar bronchi, the superior and inferior lobar bronchi.
How do the bronchi continue to branch?
The lobar bronchi further divide into segmental bronchi, with each lung having 10 segmental bronchi that supply specific lung segments. For example, the right upper lobe has 3 segments, apical, dorsal, and anterior. The bronchi continue to branch multiple times, around 18 to 20 times, becoming progressively smaller.
What are these smaller bronchi called?
The smaller branches are called subsegmental bronchi, which further divide into even smaller branches known as lobular bronchi. Each of these branches continues to split until they reach the alveoli, where gas exchange occurs.
Thank you for explaining the branching of the airways from the trachea to the alveoli.
You're welcome. Understanding the structure and branching of the airways is fundamental for comprehending how air reaches the alveoli, where oxygen is exchanged for carbon dioxide in our blood.
Can you explain the structure and branching of the bronchi?
Certainly. Let's begin with the wall of the bronchi. The bronchi have 3 main layers: the mucosa, the muscular layer, and the fibrocartilaginous layer.
What can you tell me about the mucosa?
The mucosa is lined with ciliated columnar epithelium and contains glands and lymphatic follicles. These cilia help move mucus and trapped particles out of the airways, keeping them clear.
How about the muscular layer?
The muscular layer is situated in the middle and plays a crucial role in regulating the diameter of the bronchi. This smooth muscle layer contracts and is influenced by both the parasympathetic and sympathetic nervous systems. Parasympathetic stimulation causes bronchoconstriction, narrowing the airways, while sympathetic activation leads to bronchodilation, widening the airways. The regulation is most significant in bronchi smaller than 1 millimeter in diameter.
What about the fibrocartilaginous layer?
The fibrocartilaginous layer is the outermost layer. In larger bronchi, such as those at the segmental level, it consists of cartilage arches similar to those in the trachea. In bronchi larger than 1 millimeter, it has supportive plates within the branching structure. In bronchi smaller than 1 millimeter, cartilage is absent, and the wall is composed only of the muscular layer and connective tissue.
What is the terminal branching of the bronchi like?
The terminal bronchioles are the smallest branches of the bronchi, with a diameter of about 1 millimeter. The terminal bronchioles are even smaller, at 0.5 millimeters in diameter. They consist only of a muscular layer that forms a spiral band. These are the last of the typical bronchioles, lined with ciliated epithelium that transitions to cuboidal epithelium in the periphery and lack bronchial glands and goblet cells.
What comes after the terminal bronchioles?
Beyond the terminal bronchioles, we enter the respiratory zone, starting with the acinus. Each acinus corresponds to one terminal bronchiole and contains 3 orders of respiratory bronchioles. These respiratory bronchioles have alveoli in their walls where gas exchange begins. The acini are separated by intralobular septa.
What are the respiratory bronchioles?
From each terminal bronchiole, 2 respiratory bronchioles arise. These short tubes contain collagen and elastic fibers along with smooth muscle cells in their middle layer. Alveoli are already present in their walls, marking the beginning of the gas exchange process.
What about the ductus alveolaris?
The respiratory bronchioles branch into 2 to 10 alveolar ducts, called ductili alveolars. These ducts have increasing numbers of alveoli in their walls as they progress and are lined with flat epithelium. They eventually end in a structure called an atrium.
Can you explain the atrium?
The atrium is a short passageway that marks the end of the terminal bronchioles. It's the last part where muscle fibers are present, and it transitions into the alveolar sacs, or saculi alveolars.
What are the saculi alveolars?
The saculi alveolars are clusters of alveoli, with about 10 alveoli per sacculus. These alveoli are spherical outpouchings where gas exchange occurs. In humans, there are approximately 300 to 400 million alveoli, providing a total respiratory surface area of about 80 square meters.
How do the alveoli function in gas exchange?
The alveoli have thin walls lined with a single layer of flat epithelium, which facilitates the diffusion of gases. Oxygen passes from the alveoli into the blood in the capillaries, and carbon dioxide moves from the blood into the alveoli to be exhaled. This exchange occurs across a double layer, the alveolar epithelium and the capillary endothelium.
Are there any special features in the alveoli?
Yes. The alveoli have small openings called alveolar pores or pores of Kohn. These pores connect adjacent alveoli, allowing for pressure equalization and collateral airflow, which is especially useful if a bronchiole is blocked. However, they can also facilitate the spread of infections between alveoli.
This is all very detailed and fascinating. Thank you for explaining the structure and branching of the bronchi and alveoli.
You're welcome. Understanding these structures is essential for comprehending how air travels through the respiratory system and how gas exchange occurs in the lungs.